Dizziness and vertigo. What is it and how can I help? People like labels. I'm not a big fan. What's dizziness? What's vertigo? I mean, there are different definitions. One is more a sense of disequilibrium. One is where it feels like the room is moving around. In my experience, I think people make far too much inference about exactly what's going on based on the presentation of how that altered equilibrium experience is experienced by the individual. No two people are the same, and I think if we start trying to put people into camps, oh well, that means that's BPPV, or I'm sorry, oh that's vertigo, and that's more dizzy. I'm not so convinced the more I work with it. A disequilibrium, a sense of altered orientation in space, is what we're looking at, and a feeling of not. Maybe feeling off. It can sometimes go with nausea. Sometimes it just feels like the room's moving. Sometimes it just feels like I feel like the space around me is a little bit different, but the room's not spinning. There can be many reasons. Of course, they're not all biomechanical. We can have an alcohol-induced dizziness, of course, and fall over. So there can, of course, be nutritional and biochemical basis for this. There can be, particularly with the elderly, when they sit up suddenly, they get this postural dizziness. And that is very often to do with a change in the patency of the blood vessels. And so they're less able to be reactive to the fact that now blood's got to pump uphill. And so it takes them a moment. There can be cardiac basis for these things. So these are some of the things that we might need to rule out, that we might say, well, look, these aren't really a physio, but I can refer you on to medical colleagues who can undertake investigations or medicate or look at other ways to address that. There can still be actually ways of training the postural hypotension, as it's called, using exercise within physiotherapy as well. And there's some evidence in the research to suggest that appropriate training somehow helps the system to start to be more reactive, responsive and adaptive to those altered pressures. So it's not necessarily something that we can't help with. But the mainstay of dizziness is really around upper cervical spine, in my experience. Sometimes the inner ear, in my experience, that's overdiagnosed. The amount of people who come in with BPPV and say, look, okay, this is the otoliths in the inner ear, there's the 3 semicircular canals. That can be a problem. And yes, if we need to do that, yes, I can do the Epley maneuver. Yes, we can do vestibular retraining, no problem. That's overdiagnosed. Those patients who go, look, I've had the Epley, I've had all this lot, and it's because it's not that. The proprioceptive system in the upper cervical spine is often neglected when it comes to dizziness and vertigo. We have receptors, proprioceptors we call them, particularly rich in the ligaments and the capsules of the top 3 segments of your cervical spine up here. Information from there, information from your eyes, and information from the 3 semicircular canals within your ear feed information into your brain that give us a sense of where are we in space. All 3 of those must match. Any one of those that becomes altered can cause a sensation of dizziness or disequilibrium. Yeah, so maybe that you actually need something's going on that you need to see the optician for. Yeah, and we will certainly be mindful of that. We're not opticians, I'm not going to do that, but we certainly will be mindful of that in a differential diagnosis when you come to see me. Of course, well, there are things that in the history that might indicate that this is more of an acute inner ear and vestibular problem. But often the upper neck we will palpate as well, or certainly I will do. And often if we look at, say, a brain, or well, not brain spotting per se, but in the ocular motor reflex, between how we move our eyes, there's a direct connection to initiation of movement of the upper cervical spine, and sometimes trauma can cause alters to that dynamic between the musculature in the eye and the musculature in the neck, and that can throw, you know, two of those three things out, so causing the physical presentation and manifestation you might call dizziness or disequilibrium or vertigo. So looking at how the eye moves, if there's blocks in that, looking at it in relation to the neck, or even just gentle manipulation to the upper cervical spine, the soft tissues around there, is very, very often enough to resolve the issue. There is another area around dizziness and disequilibrium where sometimes people can start to zone out as part of a trauma and an overwhelm. So think about, you know, if you can't fight or flight, you kind of zone out. Many of you know, I'm very clear, ADHD is not some irreversible affliction that we have. It is a trauma response, almost always, and it is reversible. Yeah, I know that's a controversial point, but there's good science out there, and it's not just me saying that. Yeah, I mean that not to be provocative, other than to really just to be hopeful for people who go, oh, you mean I don't have to put up with this ADHD? No, but in terms of zoning out, that sense of not quite being present can sometimes be an indication of trauma work. And so we may be that we start to look at the nervous system as a root cause for your dizziness. So the clues are always in the history. If you've got some problems, maybe you've seen some vestibular therapists and you're not getting anywhere, you know, please reach out, give me a call, let me see if I can help you. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.